Hey guys, welcome back and happy Wednesday morning to everybody. In today's video, we're going to be going over 4 tools that you may want to have to monitor for coronavirus at home. So let's dive right in. Okay, in times of uncertainty, let's give ourselves all the tools that we may need to monitor ourselves and our family members. That's just good measure. Why would you need to monitor at home? 2 reasons. If you felt unwell and you did not want to expose yourself to a clinical or a hospital setting for analysis until you were sure that there was a problem, or if your local hospital system became overwhelmed. Hospitals and testing kits, they're likely going to struggle. Let's just look at some quick numbers. In the US, we've tested fewer than 500 cases. That is of today, Wednesday, 4 March 2020. And I have heard Azar talking about how they would like to get to between 10 and 20,000 tests a day, but there are 327.2 million people in the United States currently. And even if they were able to test 10,000 people per day, we would only be able to test 3.65 million people per year. So those are not favorable statistics. So let's say that maybe your doctor wouldn't want to test. That's why you would want these tools, so that you would know that there was a pretty decent problem and that you were a good candidate for testing. What can you do? You can plan to monitor for symptoms at home and understand when you or a family member is at risk and you may potentially need medical attention. And at that time, given these tools, present yourself to a hospital or your healthcare provider when you know that there's a problem that requires further medical attention. So let's dive into the 4 tools. Tool number 1, stethoscope. The stethoscope is a device that helps physicians or healthcare providers listen to the internal organs, such as the lungs, heart, and bowel sounds, and it's also used to check blood pressure. It helps to amplify the internal sounds. So you may have ever had a conversation, or as soon as you walk into a doctor's office, if you have anything respiratory going on, the first thing that they're going to do is to listen to your lungs, both front and back, because they're listening for these kinds of sounds that can indicate clinically that there is a problem. So using a stethoscope, the doctor may hear normal breathing sounds, decreased or absent breath sounds, and abnormal breath sounds. First indicator that there may be a problem. Absent or decreased sounds can mean air or fluid in or around the lungs. And one of the biggest things that we're looking out for here with respect to the coronavirus is pneumonia. So that's what we're really trying to avoid here. And you can hear those things because there's an increased thickness of the chest wall. And overinflation of a part of the lungs, emphysema can cause this, but that's not really germane here. It is if you have emphysema, because it's a comorbidity, which may increase your risks of having problems here. And reduced airflow to part of the lungs. All right, what can listening to this tell you about your lungs? Rales, it's small clicking, bubbling, or rattling sounds in the lungs, and they're heard when a person breathes in, and they're believed to occur when air opens closed air spaces. So rales can be further described as moist, dry, fine, or coarse. The second thing is a sound that sort of resembles snoring, and it occurs when the air is blocked or airflow becomes rough through the airways. High-pitched sounds produced by narrow airways. Wheezing and other abnormal sounds can sometimes be heard with a stethoscope. Stridor, wheeze-like sounds heard when a person breathes, and usually it's due to a blockage of airflow in the windpipe, trachea, or the back of the throat. And wheezing, high-pitched sounds produced by narrowed airways. Wheezing and other abnormal sounds can sometimes be heard with a stethoscope. And guys, at the end of the video, you're going to see, well, you can look down below in the description box. I've linked to videos which teach you how to use all 4 of these tools. So you don't have to be a healthcare professional to put a stethoscope to someone's chest and hear what it sounds like normally, and I would encourage you to do that if you do decide to purchase one of these, so you have a good baseline about what it should sound like versus what it may sound like if someone is having any kind of lung complications. All right, signs of pneumonia. And again, pneumonia is probably being marked as the leading cause of death at this time with respect to the coronavirus. So this is the number 1 thing we want to be on the lookout for. Signs of pneumonia first would be a cough, which may produce greenish, yellow, or even bloody mucus. But with respect to the coronavirus, it seems that people are presenting with a dry, non-productive cough. So something to keep in mind. Fever, sweating, and shaking chills. Shortness of breath, rapid, shallow breathing. A sharp or stabbing chest pain that gets worse when you breathe deeply or cough. and a loss of appetite, just general malaise, low energy, and fatigue, all signs of pneumonia. Doesn't mean you have pneumonia, but again, using this and the 3 other tools, you may begin to understand that there is an increasing problem. Your doctor will listen to your lungs with a stethoscope, and if you have pneumonia, your lungs may make a cracking, bubbling, or rumbling sound when you inhale, which is what we were just talking about. All right, if that is the case and you go to a doctor, they will sometimes do a blood test to confirm the infection and to try to identify the germ that is causing your illness. You could just have regular pneumonia, but you could also have the coronavirus. So we're just keeping our finger on the pulse to make sure we understand what's going on. Chest x-rays to look for the location and extent of inflammation in your lungs, and pulse oximetry to measure the oxygen level in your blood. Now, pneumonia can prevent your lungs from moving enough oxygen into your bloodstream, and that is why pneumonia can be very dangerous and unfortunately also fatal. And why is pneumonia dangerous? Kind of just touched on it, but the air sacs of the lungs become inflamed and filled with fluid. And most healthy people will recover in about 3 weeks, fully recover. But in severe cases, the infection spreads and interferes with oxygen reaching the bloodstream. And extreme cases that go untreated, pneumonia will unfortunately kill. And in the article that I was reading, it says within hours, but it seems here that it takes several weeks, again, depending on age and other comorbidities. So this is not, let's freak out about pneumonia. This is, let's understand what it is, what the potential signs look like, and what it sounds like when you're listening with this stethoscope. What else can you use it for? The doctor can also use a stethoscope to hear your heartbeat, and that's, the opening and closing of your heart's valve, and it makes sort of a lub-dub kind of a noise. All right, tool number 2. And I think it's great if you can listen to heartbeat and all of that with with the first tool, but this is, we're looking at specific tools to monitor very specific vitals, so a blood pressure cuff. And this can help you to monitor elevated blood pressure, high blood pressure, which is called hypertension, low blood pressure, which is called hypotension, heart disease or other conditions, which those last 2, of course, would be difficult to diagnose, but we're looking at the high blood pressure and low blood pressure here. And what do the readings mean? Why should this matter to you with respect to coronavirus? So first, let's look really quickly at what systolic and diastolic blood pressure indicates. So your systolic blood pressure, that's usually the number on the top, and it measures the force of blood being pushed around your body when your heart contracts. And guys, I'm keeping it pretty simple here. We're not going into a deep dive about medical analysis. This is what can you do at home that anyone can do to protect themselves and their family and monitor their vitals. Your diastolic blood pressure measures when your heart relaxes between beats. So you'll usually see like 120/80, and systolic would be the top number, diastolic being the bottom number. All right, how do you use a blood pressure cuff? Try not to take your reading just before or after a meal, or if you're feeling very anxious or stressed. When you're calm, you will receive a much more accurate reading. So when you're calm, maybe an hour or so after a meal, go ahead and take your blood pressure. And you want to position your arms straight, palm facing up on a level surface such as a table, and remain still. You would record your blood pressure, and again, same thing as I said with the stethoscope, I would take a baseline. Know how to use these tools, know what sounds normal and what your normal readings are before there's a problem. That is how you would know that there was a problem. All right, follow your doctor's instructions. So let me go back for a second. Record your blood pressure. So if your blood pressure for 6 days has been X, Y, and Z, then you begin to become or to feel unwell, and over the course of several days, that blood pressure is changing, that could be an indication that there's a problem. So follow your doctor's instructions on when and how often you should measure your blood pressure and record the date, time, and the systolic and diastolic pressures. So to that end, I would pick a certain time during the day, and I would just check it at that specific time. That way you know you're getting good, consistent readings. What should your blood pressure be? Now, of course, there are going to be 5 different groups here, and normal blood pressure, again, in a normal, let's say without serious complications or comorbidities, should be around 120/80. Of course, that's going to change with age, weight, physical condition, etc. But these last 4 are what we're really going to be looking at, okay? Elevated blood pressure, that's probably someone who's going to be taking blood pressure medication. Well, actually, it could be any of the next 3. But elevated blood pressure would be systolic at 120/129, diastolic less than 80. And again, these are all ranges. They're not specific, but They are specific, but they are ranges to help you understand sort of where you are at on a line of healthy versus, okay, there might be a problem. High blood pressure, stage 1 hypertension would be systolic at 130 over 139 and diastolic 80 to 89. High blood pressure, stage 2 hypertension. And as we work our way down this list, we're looking at a more severe problem, okay? Systolic 140 or higher, diastolic 90 or higher. And then high blood pressure, hyperintensive crisis, you need to be in a hospital. There needs to be medical intervention here. Systolic higher than 180, diastolic higher than 120. When you decide that your blood pressure is problematic for you is a personal choice based on your personal health history. I'm just giving you just some general ranges. All right, why does it matter? High blood pressure makes your arteries less stretchy. I know that doesn't seem like a medical term, but I'm trying to make it as simple as possible. This can lead to a buildup of fatty deposits, which can make it more difficult for blood and oxygen to circulate throughout the body. And high blood pressure can lead to stroke, heart attack, heart failure, kidney disease, and vision loss. So if you look at this little image here, on the left, you would have a good, clean, healthy artery, and on the right, you have a buildup of fatty deposits. So as you see that area is narrowing, of course, there's going to be less room for blood, oxygenated blood, to move through your arteries. And that is where you're going to have a problem. All right, tool number 3, a blood oxygen monitor. A pulse oximeter is a medical device that indirectly monitors the oxygen saturation of a patient's blood, as opposed to measuring oxygen saturation directly through a blood sample, which is what they would do if you went to a hospital setting. Why would you want to know this? In medicine, oxygen saturation, commonly referred to as SATs, measures the percentage of hemoglobin binding sites in the bloodstream occupied by oxygen. So if you're using a pulse oximeter at home, readings will normally range between 95 and 100, and values under 90% are considered low. That doesn't mean to freak out that there's a huge problem, but again, going back to what I said, take a baseline reading before there's a problem. So if you're always at 97, 98, and all of a sudden you find yourself at 89 for a sustained period of time, this is something you may want to pay attention to. When to get help. Arterial blood gas ABG analysis is a test regularly performed to measure oxygen saturation, carbon dioxide, and bicarbonate blood levels. So that's what I was saying. So the pulse oximeter is great for using at home. If you present to a hospital setting and there's been a sustained problem, they very likely will order this ABG analysis. Pulse oximetry is a non-invasive and quick way of measuring the oxygen saturation of a peripheral arterial hemoglobin. So in other words, it's telling you how much oxygen is in your blood. Normal arterial oxygen is approximately 75 to 100, and that is if it's a blood test right here, these numbers, okay? And values under 60 usually indicate the need for supplemental oxygen. So again, that is for a blood test, but for a pulse oximeter, anything between 90 and 100, normal range. Some of the supplemental oxygen methods would be things like ECMO, mechanical ventilation, potentially just, the little tubes in your nose that are pushing oxygen. What we're trying to avoid with low blood oxygen levels is hypoxia, and that is a condition in which the body or a region of the body is deprived of adequate oxygen supply at the tissue level. And it means that you have low levels of oxygen concentration in the blood, and this can lead to cyanosis. And cyanosis is a visible blueness as a result of increased levels of deoxygenated blood. Reduced levels of oxygen in the blood can lead to damage to the heart, lung, brain tissue, and death. And so in the Spanish flu in 1918, I think they would refer to it as the blue death, because after a certain period of time, a patient would begin to go blue, and that would sort of work its way down their body. And they would know this patient is experiencing cyanosis, and the prognosis at that point was not going to be good. Death would usually come within a few hours. So you're going to have oxygenated blood, which is what we want. That's why we're measuring with the pulse oximeter, and then deoxygenated blood, which is what you do not want. All right, tool number 4, a thermometer, an instrument for measuring and indicating temperature. The average normal body temperature is generally accepted to be around 98.6, and some studies have shown that normal body temperature can swing pretty widely between 97 all the way up to 99. A temperature over 100.4 most often means that you have a fever caused by an infection or illness. It does not mean that it's time to run to the hospital. It just means, okay, let's monitor this particular vital because we may have a situation developing. And temperature readings for adults and children can be slightly different. A typical adult body temperature can be anywhere from 97 to 99. And babies and children have a little bit higher range between 97.9 and 100.4. If you're a parent, you already know this because if you call your doctor and say that your child has a 102-degree temperature, they don't start to take, well, I don't want to say don't take it seriously, but they don't move you up the ranks of needing medical intervention until that temperature climbs much higher. All right, why would you want to monitor your temperature? Anything above 100.4 is considered a fever. You may feel terrible, but on the whole, a fever isn't bad for you. It's just a sign that your body's doing what it's supposed to do when germs invade. It's fighting them off. So, and there are conflicting opinions about whether or not you should reduce a temperature. So I'm not going to get into too much medical lingo here, but the short version would be that if your body temperature is elevated as an adult, let me throw that in there, as an adult, that may not be a bad thing because your body is fighting off whatever it is that has invaded your body, and viruses do not like hot temperatures. So the hotter your body is, the less chance that virus is going to have to replicate and to cause larger problems. That said, if you're dealing with a child, that's a different situation. I believe the general consensus is that you would want to administer fever reducer to bring that fever down. Now, if we've moved past that and your temperature is 103 degrees or up, and you've had that fever for more than 3 days, especially if your other vitals, the ones that we were talking about, your blood pressure, and you have kind of rattling sounds in your chest, if all of these things were happening in concert together, I think it's fair to say that you need some kind of medical attention. So that's when it would be time to call the doctor. And why are fevers dangerous? We all know that we want to avoid them, but specifically why? More serious fevers in which the body temperature rises to about 108 or more can result in convulsions and death. That would be an extreme case. High-grade fevers range from about 103 to 104. Again, this is still manageable. We've all run across this with our children and ourselves, that this fever can be knocked back every couple of hours with a fever reducer. But dangerous temperatures are high-grade fevers that range from 104 to 108 or higher. Extremely high fevers are also termed hyperpyrexia. Once you've graduated past 104, I think it's fair to say that medical intervention is at hand. But again, that's a personal decision for you when you decide that you need to move from home monitoring to, okay, we need to go to the hospital. Hyperpyrexia is a fever of 106 or higher or 104 or higher, depending on who you're listening to, and it is considered a medical emergency. If the fever is not lowered, organ damage and death can result. So something to pay attention to. All right, and I just did that really quick run through because I know that we all hear about these tools and we may or may not have them at home, but understanding what we're monitoring for is a powerful tool to have at home. All right, because especially if the medical systems become overwhelmed, which they very likely will be if the caseload increases, being able to perform these general vital monitoring practices at home is going to be a very powerful tool for you. And so here's a quote in closing. Everything we do before a pandemic will seem alarmist. Everything we do after will seem inadequate. And I think that's a pretty fair way. It may seem a little over the top to have these 4 tools at home, but actually it's not. Even if we weren't looking at the coronavirus and trying to deal with that situation, these are good tools to have at home for anyone who is currently unwell, may become unwell. These are great things. If they weren't important, it wouldn't be the first battery of things that they do when you walk through the door at a medical facility. As you can tell, that's basically their level of triage. Okay, this person has normal vitals and they're presenting with these other symptoms. Now let's do X, Y, and Z. But if you walk in the door and your vitals are out of normal range, you're going to get moved up the line because they're going to know, okay, there's a problem. So this whole video is about making sure that you can present to medical facilities for medical care when it is actually necessary, not because you're afraid and you're feeling a bit unwell, but okay, I know that there's a problem, let's get some help. All right, and to help you during this time, Links to how to use these tools are listed in the description below this video. I just looked up how to use, the blood ox and the blood pressure cuff and all of that just to make that easier for y'all. They are linked below. Now, I have listed the exact products that my family and I own for those who are interested, because I'm trying to answer that question before there are 100 questions in the comments. I know sometimes if I'm listening to somebody, I'm like, that's all great. What do you have? So in that vein, I'm going to list those products below. But guys, you can purchase them from anywhere. You can go to Walgreens, Walmart, Amazon, wherever you can find them. And these tools are all very affordable. I think the stethoscope was around $15. The blood oxygen monitor was $30. The blood pressure cuff was around $30. And the thermometer, one of them was around $20 and the other one was around $80. So, buy the tools that you think are most appropriate for your family. I did a lot of research to settle on the particular ones that we own, and they're only listed for your convenience. It doesn't matter to me whether you use the links or not. I'm just trying to help myself and help you to answer an influx of questions about which specific one did you get. So that is going to be it for this video. If you found that helpful, please give it a like. Leave any questions that you have below in the comments. Let me know which tools you think that you should get. And if you want to be notified when I upload new videos, just go ahead and click subscribe and turn on that little bell notification to be notified whenever I upload a new video. And that is going to do it for today, guys. Again, as this situation develops, these videos not being put out in an attempt to encourage panic, just to say, okay, we are dealing with this global problem. And of course, I'm looking at what's happening inside the United States specifically. And okay, the load on the hospital system is going to increase. How can I protect myself and my family from being out in the masses when they may just feel a little unwell? And then, I would feel so terrible if one of my family members didn't feel well and I had to take them to the hospital because I couldn't monitor any of these vitals, and then I exposed them to the coronavirus. So that is not a situation that I want any of us to have to experience. And I am not in any way discouraging you from going to your doctor or going to a hospital. I am saying for you and your family, if you feel that based on whatever the current situation is, wherever you live, that that's not an environment you want to put yourself in, then these are tools that you can use to help your family at least avoid that trip for as long as possible. So that is the purpose of this video. I hope you found it helpful. Please just breathe, relax, prepare, and we will all get through this together. I will see you guys in the next one. Thanks for spending some time with me. Bye-bye.